Welcome back. 38 minutes after the hour. Peanut allergies are one of the most common and scariest for parents of young children, and they have skyrocketed in the last 20 years. In 1997, less than 0.5% of kids were affected. Now is up to 2% across the Western world, according to the National Institutes of Health. And new research out of Northwestern University shows there may be a simple way to help prevent the allergies, starting right in the doctor's office. NewsNation weekend anchor Anna Kooiman joins us now with the very latest. Anna, good morning. You spoke with the researcher of that report. What did we learn?
Right. Good morning, Nick. So the old guidance, it's important to remember, it was to keep babies away from peanuts early on. But this new guidance about early peanut introduction, reducing risks of allergies later in life, has been in place for years. Yet for some reason, doctors alerting parents properly in busy clinics has been a real problem. So Dr. Ruchi Gupta told our team that this study finally cracks the code to make it easier for doctors and parents to stay on track using simple digital reminders to turn research into real-world results.
I think the big issue is that pediatricians are very busy in those 4 and 6 month well child check visits, and adding something else to their plate without giving them some helpers, some things that'll help make it happen is really challenging. So what we did is we were able to discuss with them what they need. And the easiest things that help them are prompts in their EMR, and also like something for the parent.
So that's really the key. They met doctors and parents where they are. The training includes simple prompts in electronic medical records and easy handouts for parents to take home. Put it on the refrigerator somewhere to remind them. So even in a quick 4 or 6 month checkup for the little ones, both sides get a reminder to start early and to start safely. So Dr. Gupta says that combination of education plus the reinforcement is what's really moving the needle, Nick.
And Anna, that seems pretty straightforward and seems like a simple fix. And it seems to be working in the Illinois pediatric clinics they're working with. But Anna, the obvious question is, what are other doctors saying about the impact this could have long term?
Yeah, and also you mentioned it's so straightforward. It really is. So some parents with kids who have peanut allergies are saying, what has taken so long to implement this properly? We did speak to Dr. Will Haas. He's an integrative medicine specialist, and he says if these new training tools continue to spread nationwide, we could be talking about a generational change in how many kids develop food allergies.
Prevention's always a much more powerful tool than reaction. And if we can teach every pediatrician these simple tools, we could reshape the trajectory of food allergies in an entire generation. So that could be tens of thousands of kids that ultimately end up spending less time in the emergency departments.
Yeah, it can be terrifying. It's really, really troubling for families who have kids with peanut allergies. And Dr. Gupta says the next step in all of this is seeing if this actually translates into fewer allergies, if these parents using these tools that are given by the doctors, these electronic tools, can really make a change. Researchers are now going to be analyzing the data from those same babies as they turn 2 years old to find out whether this early peanut introduction and these new electronic tools is going to truly help eliminate peanut allergies altogether. So some exciting developments potentially down the track coming, Nick.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.